My name is Ravi Gupta. I'm a primary care doctor and a health policy researcher and an assistant professor at Johns Hopkins University in Baltimore, Maryland, in the United States. I work on a lot of different areas that are all supported by the idea of healthcare equality. So, for example, I think a lot about pharmaceutical policy and access to medicines, as well as insurance design and coverage policy and how we can best provide healthcare coverage and healthcare services to patients across, particularly in the US, but also across the world. So in the United States, often used as an example of an extreme case of insurance coverage policies, there's both public and private sources of coverage policy, even within public programs. And so there's a specific private program in which public dollars are being given to the private side, to insurers, to provide coverage policy to patients. And so I'm interested in understanding how enrollment in one of these two, whether it's the private side or the public side, shapes patients' ability to access healthcare services and to be able to have good health. I think there's a lot of trends towards trying to privatize healthcare, including public programs, and one of the projects that I'm working on really responds to that push to try to privatize a public program. And so that creates a structure that's really hard to not just study, but to push against, coming from the idea that there should be healthcare equality, that everybody should have access to a minimum set of services, because there are different incentives on the private and the public side. And given those political forces, given the lack of political will to try to support the public system is, I think, a huge challenge, at least in the United States, but certainly across the world as well. Events like this academy, thinking very deeply about some of these questions, both from an ideal world and thinking about it philosophically, but also trying to apply it to practical, on-the-ground context. I think events like this give me hope because there are a lot of people that are thinking about these problems and trying to come up with creative solutions to actually move the needle.